I want to talk today about transvaginal pelvic mesh. There's been a lot of controversy because for the last 5 years there's been television commercials warning women that if you've had slings or transvaginal mesh replaced, you could be in trouble and you need to call this attorney immediately. Mesh is something that's made out of polypropylene. It's a plastic, and it's been used in surgery for 50 years. Polypropylene is actually the material used in permanent sutures that is used in probably every single surgical specialty there is. Mesh is when they take the polypropylene and they weave it into a fabric, and it's used to support organs that are coming out, whether someone has a hernia in their tummy and their belly button sticking out, or in their groin, or in the case of women, if their bladder's leaking or if their vagina is falling out. So in 1996, bladder slings came out, and these are small pieces of polypropylene mesh that are inserted underneath the urethra to hold the urethra in, so that when a woman coughs, sneezes, or leaks, that she doesn't have, she no longer leaks. These things work very well. They're considered the international gold standard. Not every woman needs to have the sling placed. There are other things that can be done that work almost as well. So if a woman doesn't want to get something like this dealt with a condom, there are other options. Now, transvaginal pelvic mesh was invented by these companies in 2004, which are very big pieces of mesh that are designed to hold the bladder in, hold the vagina in, hold the rectum in, and they're attached to big ligaments. And since they're such big pieces of mesh, they have been noted to cause some issues and complications with women. We still occasionally use these products, but most of the time we don't. We do specialize in removing these products for patients that have had these inserted in their bodies, and we have patients that come from around the country for evaluation to have us remove it. It's something that's done typically in the operating room or the procedure room, and it's something that someone recovers from very quickly. So if you've had this mesh placed and you want to have an evaluation for whether it's something that has to be removed or doesn't have to be removed, or if you have issues with pelvic organ prolapse or bladder leakage, please give us a call, come and see us, and we'd be happy to take care of you.